Hello, students. This is the lab for the endocrine system. In another video, we looked at the endocrine organs and tissues. In this video, we're going to talk about endocrine disorders. Hopefully, you remember from lecture that hormones are very powerful chemicals. They have wide-ranging effects throughout the body. They need to be regulated because if there's too much of a hormone or too little of a hormone, it can cause very strange disorders. We're going to look at a few. For this section, what you need to know is you need to be able to recognize the disorder by sight, a picture, or you need to be able to recognize it by a description. You need to know the hormone that's associated with the disorder. Not only that, you need to know if it is a hypersecretion, too much of the hormone, or a hyposecretion, too little of the hormone. The first one we're going to look at is called giantism, or sometimes gigantism. Giantism is when you have excessive growth in very tall people, sometimes over 8 feet tall. It's a pretty rare disorder, and it's caused when you have too much growth hormone, but not just at any time in your life. It has to be during childhood, the growth period. It has to happen before the epiphyseal plates fuse. If you look at this picture, you'll see what is supposedly the tallest man that ever lived. And look how tall he is. He's standing next to a normal height adult male, and he's almost twice that person's height. Here's another example of giantism, and this one has a funny little story with it that I'm going to share with you. This guy's name was Charles Byrne, and he lived in the 1700s. He was sort of a socialite around London. He loved fine wine and cigars, and he loved fancy clothes. He got invited to a lot of parties. He was kind of an oddity or maybe a freak, and so people enjoyed having him around as sort of a topic of conversation. Well, one time when he went to a party, he met a guy. And you can see in the picture here, they're shaking hands. This guy is named John Hunter, and John Hunter had a museum. It was a museum of oddities, and so he collected all sorts of specimens, and the museum, which is called the Hunterian Museum, actually became part of the Royal College of Surgeons, and it was displayed for almost 200 years. Well, John Hunter, and you can see him here again, followed this guy around, met him at all his parties, and he followed him around, and every time he ran into him, he would say, "May I have your skeleton when you die?" Well, that's kind of a freaky thing to have people ask, and he became so paranoid that when he died, he put into his will that he wanted to be buried in a lead coffin at sea so that there was no way his body could ever be in this museum. And here on the left, you can see there's his lead coffin, and there's his body. Well, John Hunter was smart, though. He showed up at the wake before the funeral, brought a whole bunch of whiskey, got everyone drunk. They all passed out. He stole the body, filled the coffin with rocks. They buried the coffin full of rocks at sea, and then John Hunter put this man's skeleton into his museum. And here you can see the skeleton, and you can see just how tall it is. This is still on display in London, so if you ever go to London, you can actually see it. Again, giantism is caused by too much growth hormone during childhood. Here's some other giants, and you can see just how tall these people are. Something similar to giantism, but slightly different, is called acromegaly. This is also caused by too much growth hormone. But remember, during childhood, if you have too much growth hormone, you get giantism. You grow very, very tall. But if you wait until the epiphyseal plates are closed, that growth hormone cannot produce or make you grow any taller. What it can do, though, is make your bones get thicker and wider. And so you wind up with very heavy jaw. You wind up with big highbrow ridges and thick fingers and so on. This is usually caused by a tumor, and the tumor can be removed, but these symptoms can't be reversed. But if you look at these pictures, you'll see the progression of the disease. So if you look at the top, you'll see this young woman. Pay close attention to her nose and her chin and her eyebrows, ridges, and then look at it as she progresses through the disease. Same thing with the bottom. There's this young man. Look at his nose and his ears and his chin, and you can see what happens. So again, this is acromegaly, and it's caused by too much growth hormone after the epiphyseal plates have closed during adulthood. The opposite disease of giantism is called dwarfism. Now, there are several different types of dwarfism. Some types of dwarfism cause sort of out of proportion bodies, but this one, pituitary dwarfism, does not. And so what you wind up with is just sort of a miniature looking person. Their body proportions are normal, but they're just tiny, tiny people. Some of them can be as short as 30 inches tall. So if you look at this is not a child. This is an adult woman. And he's holding her almost like a doll. Here you can see another one. This is also pituitary dwarfism. Too little growth hormone during the growth period. And again, you can see how small these people are. And here are some comparisons with children of their same age, but normal height. Another disease that's caused by a lack of growth hormone is called Simmons disease. But Simmons disease happens to adults. Now, you can't get any shorter, but what does happen is your bones waste away. But not only your bones, your muscles, your fat, everything sort of slowly disappears. And so over time, you begin to look almost like a walking skeleton. You lose all of your muscle mass, you lose all of your bone mass. Eventually, you're unable to even stand up. Now, this disease is not seen very much anymore because it's treatable. We treat it by providing growth hormone. Let's look at another one. This is called diabetes insipidus. Most people, when they hear the word diabetes, they immediately think of blood sugar. But that's not what diabetes, the word, means. What it means is excessive urination. Well, this is diabetes insipidus. These people produce excessive urine, and insipid means bland. So the urine is very, very, very dilute. It is so dilute that you really can't tell it from pure water. It's caused by a lack of ADH. And so without ADH, the kidneys just put out urine at huge amounts. A person with diabetes insipidus can produce up to about 5 gallons of urine per day. The normal person only produces about 1.5 quarts a day. Well, if you make 5 gallons of urine every day, you also have to drink 5 gallons of water. And so there's huge excessive thirst that goes along with this. People used to jump out of moving cars and drink water from ditches. They would drink water from toilets. Or in this case, you can see this woman just upending a pitcher of water. Without water, you get dehydrated very quickly, and it can cause death. But this is a treatable disease. We treat it by providing ADH. There are 2 types of diabetes insipidus. In order for ADH to produce its effect, it has to be released from the pituitary, and then it has to have an effect on the kidneys. So you can have a problem with the pituitary, that's called central diabetes insipidus, or you can have a problem where the kidney is, and that's called nephrogenic diabetes insipidus. Either way, it's because of the ADH problem. Either there's not enough of it, or the kidneys don't respond to it. Let's look at a different one. This is called hyperthyroidism. So even in the name, you can tell it's a disease of the thyroid. Hyper, remember, means too much or more. And what you get here is you get too much thyroid hormones, T3 and T4. Well, remember, T3 and T4 are the major metabolic hormones of the body. They drive your metabolism. So when you have too much of that, the metabolism is just in overdrive. You produce lots and lots and lots of energy, lots of heat. And so these people burn energy like crazy. They lose weight. They can't sleep. They're jumpy. They're jerky. They have an inability to maintain focus. Sometimes they develop things like tremors and diarrhea. There's also another symptom, which is sometimes happen. The thyroid enlarges, and an enlarged thyroid is visible. That's called a goiter. One other symptom that you associate with hyperthyroidism is that the eyes bulge forward. It's called exothalamus. What happens is fluid builds up behind the eyeball and pushes it forward, and then that fluid is slowly replaced with fibrous connective tissue. Once the connective tissue is there, it can't be reversed. And so when you look at these people, they always look like they have a surprised look on their face. Remember, they're going to also lose weight. They're going to be hot all the time, jumpy, inability to sleep. And again, this is hyperthyroidism. It's caused by too much T3, T4. Now, the most common type of hyperthyroidism is called Graves' disease. But these two are not exactly the same. Graves' disease is a type of hyperthyroidism, but it accounts for about 95% of the cases. Let's look at the opposite of that. The opposite of that is hypothyroidism, and in the adult, it's called myxedema sometimes. Myxedema or hypothyroidism is when you have an underactive thyroid. In other words, there's very little T3, T4, so the metabolism is very low. So these people are tired all the time. They're sleepy. They're depressed. They tend to gain weight. They tend to lose their hair, and they tend to have all sorts of other issues. You can also have an enlarged thyroid or goiter with hypothyroidism. Remember, we saw the eyes bulging out with hyperthyroidism. Here, almost the opposite thing happens. They look sunken in. You have this dull look on their face. Again, their hair is brittle and falls out. This is too little T3, T4 in the adult. Remember, I said that you could have a goiter with both hyperthyroidism and hypothyroidism. One of these is called a toxic goiter. In other words, it's putting out too much T3, T4. The other one is called a simple goiter. It's not putting out T3, T4. Simple goiters are usually caused by a lack of iodide in the diet. So if you've ever noticed or read what your salt says, the package will say contains iodide, a necessary nutrient. That's why we don't see these goiters the way that we used to, because we iodize our salt. There are places in the world, though, that do not iodize their salt. And if they're not near an ocean or a sea, they tend to have low iodide in their diet, and goiters are very, very common. There's another condition associated with an underactive thyroid. But this is when it's underactive during early childhood or at birth. What happens here is the body just doesn't develop. You wind up with a short stature, so they look almost like a dwarf. but they have short, thick necks. They also have a certain look on their face. And you can see that children often have their tongues sticking out. Well, not only is the body affected by this, but so is the development of the central nervous system. And so we wind up with central nervous system deficiencies. So cretinism, which is a permanent condition, is very, very important to prevent. And so when, at least in this country, when babies are born, within a few hours, a blood sample is taken and analyzed for T3, T4. If it's low, then they begin to supplement it almost immediately to prevent this from happening. Again, this is called cretinism or hypothyroidism in children. And it's when you have too little T3, T4 at birth or in early childhood. So look at another one. This is called pheochromocytoma, or sometimes just called a pheo, or maybe a PCC. This is a tumor usually of the adrenal medulla. Remember, the adrenal medulla is part of the sympathetic nervous system. It's part of the fight or flight nervous system. And when it's activated, remember this adrenal medulla releases epi and norepi into the bloodstream. That then travels everywhere, and all of the tissues it goes to enter fight or flight. Well, a pheo just randomly releases epi and norepi into the bloodstream. So randomly, could be infrequently or very often, you just go into fight or flight for no reason. Remember what happens with fight or flight? The heart rate goes up, blood pressure goes up, you start sweating, your eyes dilate, your digestive system shuts down, and so on. And so these are the symptoms of a pheo. But again, it's not due to any kind of danger. It's just random. The only treatment for this is surgery. Let's look at another one of the adrenal gland, but this is not the adrenal medulla. This is the adrenal cortex. Now, if you should remember, the adrenal cortex is divided into 3 zones, and each zone produces a different type of hormone. Remember, we had the mineralocorticoids, we had the glucocorticoids, and we had the gonatocorticoids. Well, you can have too much or too little of any of these. If you have too much of these mineralocorticoids, remember the main one of those is aldosterone, it's called aldosteronism or hyperaldosteronism. Sometimes it's called Cushing's disease after a doctor. But it's when you have way, way, way too much aldosterone. And what happens with aldosterone is, remember, it makes you retain sodium. And when you retain sodium, you retain water. So these people have very high blood pressure. They have lots and lots of fluid into their tissues, which means that the osmotic pressure is really low. They can wind up with things like temporary or permanent paralysis. They can wind up with muscle spasms. pH is off, all sorts of problems. If you look here in this picture, you can see all this person did was push her thumb into that person's foot, and it leaves this indentation. That's because there's so much fluid in those tissues. Another thing aldosterone does, if you remember, is it causes you to get rid of potassium. And so not only do you have too much sodium and too much water and high blood pressure and all that, you have too little potassium. And too little potassium can cause problems in resting potential of the muscles and the heart. So these people are at risk for stroke, they're at risk for heart attacks, and so on. Another condition of the adrenal glands is called Addisons disease. And Addisons disease is a sort of a byproduct disease. It's when you don't have enough aldosterone and sometimes don't have enough cortisol. Well, one of the symptoms of Addison's disease is a darkening of the skin, but it's not caused by the lack of those hormones. Those hormones are controlled by ACTH. And when there's no aldosterone and no cortisol, ACTH levels rise. They rise and they get higher and higher, trying to stimulate those other two hormones. Well, this excessive ACTH is what causes the darkening of the skin. The other hormones are what cause the issues associated with Addison's that are more extreme. And those are things like messed up blood glucose, messed up sodium and potassium levels. And so you can wind up with things like low blood pressure, vomiting, consciousness loss, fainting, and so on. Here in these pictures, though, you can see this darkening of the skin that occurs. It's not uniform. It's more often in places where there's irritation or excessive pressure. Let's look at another one. This is called Cushing's disease. Cushing's disease is when you have too much cortisol. It's usually caused by having too much ACTH, which in turn causes the release of cortisol. But the cortisol is what causes the symptoms, and the symptoms are many. You wind up with weird fat distributions. You can wind up with a thick layer of fat between the shoulder blades. It's called the buffalo hump. You wind up with fat in the abdomen and fluid in the abdomen, so you get this big, thick, pendulous abdomen. Connective tissues start becoming weaker and break down. And so that pendulous abdomen can cause stretch marks, and you can see these purple stretch marks. They're permanent. You can't get rid of them. You wind up with a very round face. It's called moon face. And so when you see this, you can see all sorts of these symptoms. They're very obvious. Bruising happens and it doesn't go away. The arms and legs thin out because muscle is burned instead of fat. Connective tissue degenerates, so you wind up with torn ligaments and broken bones and stretched and torn skin. It's a very, very, very serious condition. Here you can see the moon face. And if you look at the little boy before and after, you can see exactly what a huge difference it is. Here you can see these pendulous abdomen and striated stretch marks, those purple stripes. Let's look at another one. Remember that zona reticularis produces sex hormones. Well, sex hormones are normal in adults, but they're not normal in children. And so when you have sex hormones at an early age, you can get what's called precocious puberty. So this young boy is already going through puberty, and he's growing a beard and chest hair and pubic hair. This happens to children as young as just a few months old. Not only do you get these symptoms, but remember the hormones of the sex hormones cause the closing of the epiphyseal plates. And so this person is going to wind up with a very short adult height. Here you can see several different children that are having precocious puberty. And if you look at the size of the genitals, the far right, you can see the difference. Look at also the face. The face looks like the face of a teenager, not the face of a child. It's not round and soft looking anymore. This is when you have too much of these sex hormones at an early age. The sex hormones can be male sex hormones that we just saw, or they can be female sex hormones that you see here. And so you get too much female sex hormones at a young age. You can even begin menstruating. And so menstruation can occur as young as just a few months. The youngest mother on record, her name was Lena Medina. She was from Peru. And she had a baby when she was 6 years old, which means she got pregnant when she was 5 years old. She had a normal little baby boy by C-section, and her parents adopted the boy and raised him as her brother. So the two of them grew up really thinking they were brother and sister. Now, we still don't have any idea who the father of this child is. But if you Google Lena Medina, you'll get a whole history of this. You can also have the wrong sex hormone. So when you have the wrong sex hormone, what's going to happen is it's going to change your body toward the other sex. So if it's a female, that female is going to begin to look like a male. And so you get virilization or masculinization. So when you look at this picture, these are not two men. This is a man, his wife, and their child. And you can see that she's breastfeeding her baby. And so what's going to happen is you're going to get changes in musculature and changes in voice and changes in hair growth and so on. If it happens at a young age, the female is going to begin to look like a male. Now, they can't ever grow a penis, but the clitoris does enlarge and becomes what's called a pseudopenis. Let's look at another one. If you look at the hormone prolactin, prolactin literally means for milk. So the only time a person should have prolactin, at least in large amounts, is when they're lactating. So for 90% of a female's life, there's very little prolactin. And for 100% of a male's life, there's very little prolactin. But if you give either one of these prolactin, they will begin to secrete milk. So the top picture is a male producing milk. And then you can see milk produced here. Even babies can produce milk if they're exposed to the hormone prolactin. Now in this picture, not only do you see milk production, but you also see breast enlargement. Those are two different things. Breast enlargement is called gynecomastia, and then milk production, inappropriate, is called galactorrhea. Let's look at the other type of diabetes. This is the one most people think of when they hear the word. But remember, diabetes doesn't mean blood sugar. What it means is excessive urine production. But mellitus means sweet. And so these people produce a lot of urine, but it's not bland like that other urine. It's sweet. That's because there's sugar in the urine. It spills over from the blood because the blood sugar is too high and the kidneys are unable to reabsorb all that sugar. And so sugar winds up in the urine. Diabetes mellitus is one of the worst diseases that you can have. It's a very chronic disease, but it affects every single cell in the body. It can cause things like cardiovascular disease, stroke, kidney disease. It can cause ulcers that won't heal. It can cause damage to your nerves, damage to your eyes. It can cause cognitive impairments of the brain. It can make you ketoacidotic, which means it's screwing up with your pH. You can go into comas. And people who have diabetes mellitus, on the average, only live about 10 years less than they would have if they didn't have it. There are 3 cardinal signs, which means they're present in all cases, of diabetes mellitus. One we already talked about, and that's excessive urination. That's called polyuria. Well, if you urinate a lot, you have to drink a lot of water, and so you have excessive thirst. That's polydipsia. We have both of those in the other type of diabetes insipidus. But this one has a third cardinal sign, and that is that you're hungry all the time because you're losing glucose. You're losing your primary energy source. It's just being pushed out down the toilet. And so not only do you have polyuria and polydipsia, you also have polyphagia, which means you have excessive hunger and eating. People lose weight like crazy. If you look at this person here, you can see before and after pictures. You can see just how much weight she lost. And then once she was treated, how it came back. Now, this person happens to be the daughter of two people who studied diabetes mellitus, and she's the first person who was ever successfully treated for this disease. There are two types of diabetes mellitus, much the same way that there were two types of diabetes insipidus. Again, one of them is a hormone problem. The other one is a receptor problem. So type 1 diabetes results from too little insulin. Type 2 diabetes is when the insulin is there, but the receptors don't work, or there aren't any receptors to begin with. And then there's another type of diabetes, which is usually temporary, and this is caused by a different hormone. It's called gestational diabetes, and it's caused by cortisol, not insulin. Here's this person again who was the first person treated with insulin. As I said before, there's not one part of your body that's not affected by diabetes mellitus. This is the retina of the eye, and you can see these hemorrhages which cause blindness. So if you take a look at this graphic, you can see all of the symptoms of diabetes, and there are lots of them. There are no parts of the body that are not affected. Let's look at another one. This is called hyperparathyroidism. Remember, the parathyroids are somewhere between 4 and 8 small glands that are located on the posterior side of the thyroid. Here you can see those, and one of these, which is labeled number 1, is greatly enlarged, and that enlarged gland is putting out too much PTH. Remember, PTH, parathyroid hormone, is all about blood calcium. It raises blood calcium. It has to get that blood calcium from somewhere. Well, the most common place in your body with blood calcium is your bones. About 99% of your blood calcium is in your bones. So PTH pulls it out of your bones. And the more PTH there is, the more it pulls from the bones. And so if you look at what the bones look like, you can see that they look thin and spongy and even rubbery. They're decalcified. So they've become very, very easy to fracture. They become very, very friable. They also misshape. And so you can get all kinds of weird things happening too. Well, that calcium, once it comes out of the bones, it has to go somewhere. And so you can wind up with kidney stones. You can also wind up with it being deposited in places it's not supposed to be, so you get soft tissue calcification. In this picture on the left, you can see how thin the bones are, and then in this picture on the right, you can see how misshapen they can become. The opposite of that is hypoparathyroidism. And this is when you have too little PTH, which means you're going to have too little blood calcium. And too little blood calcium causes all sorts of problems. Remember, we use blood calcium in things like muscle contractions. We used it for synaptic transmission and other things like that. And so we wind up with hypersensitive nerves and hypersensitive muscles. And so you can wind up with twitching and cramping and tetany. So hypoparathyroidism, too little PTH. So that's the end of this part of the homeostasis of the endocrine glands.